Getting up in the middle of the night to urinate is called nocturia. Nocturia is very, very common. In fact, most people get up once or twice at night to urinate, starting in the teenage years even. If you think about it, there's only two possible reasons why someone would get up in the middle of the night to urinate. One is that their bladder doesn't comfortably hold enough to allow them to sleep through the night. And two, you make more urine, or that is to say your kidneys make more urine than your bladder can comfortably hold overnight. The second condition we call nocturnal polyuria. The nocturnal means nighttime, and poly means too much, and uria means urine. So nocturnal polyuria means that you make too much urine overnight. And that's probably the commonest cause of nocturia. The most common cause of that even is just drinking too much before you go to sleep. So if you have a couple of beers, or you have wine before dinner, and then you take a glass of water with some pills, all of that fluid that you ingest will then overnight be converted by the kidneys to urine. And then if you make more urine overnight than your bladder can hold, then of course you have to get up to urinate. So nocturnal polyuria is the commonest cause. And the other cause, the bladder not holding enough urine, has many, many, many causes. Probably the most common one is a temporary problem, is urinary tract infection. It can be caused by blockages by the prostate. It can be caused by bladder cancer, by all kinds of other irritable kind of conditions. So thinking back, then we have these two different causes: making too much urine at night, or the bladder not holding enough at night. So then what to do about it? Well, the first thing you need to do about it is to diagnose it. How do we diagnose it? Very, very simply. We have you keep a bladder diary. That is to say, you record the time and amount of urine, time and amount of each urination that you make in a 24-hour period. Then we simply see how much you urinate at night, how much you urinate for the 24 hours, and through some mathematical formula, we can figure out if you're making too much urine at night. Generally, people make less than a third of their urine during sleep hours. If you make more than that, then you have this nocturnal polyuria, and we look for the causes of that. I briefly alluded to what they were in the beginning, but now to get more complete, the most common cause is simply drinking too much. Probably the second most common cause is people that take medications at night that can have a diuretic-like effect. Another cause is anything that causes your legs to swell up. So people with varicose veins or from prior surgery, if your legs swell up during the day, that the swelling is actually fluid. And when you lie down at night, your body resorbs that fluid. That fluid gets into your system and the kidneys make more urine. Another common cause is something called sleep apnea. People that snore, that's diagnosed with by going to a sleep lab. And if you have sleep apnea, then that's what causes the problem, and the treatment of the sleep apnea is the problem. The bladders that don't hold enough urine, we first determine that by the bladder diary, and then we look for the common causes. The common causes are urinary tract infection, prostate obstruction, a drop bladder in women, overactive bladder, sometimes bladder cancer, bladder stones. No matter what the cause, though, once the diagnosis is clearly understood, then treatment of the underlying condition that's causing the nocturia is very often effective. It's usually effective. However, just having nocturia, just getting up at night to urine by itself, doesn't demand any treatment. So if you get up once or twice at night or 3 times and you're not bothered by it, there's no need for any treatment at all. If there is a need for treatment, if you're bothered by it, rest assured there's just about always an effective treatment.